Okay. Well, good afternoon, everyone, and thank you for tuning in. Being informed, working with facts and fact information, and continuing to work together as a community is how we're going to get through these difficult times. We're in this for the long haul. We should expect months, and so we're already focusing not just on today, but on the next phases to come. I support Governor Burkin's executive order addressing restaurants and bars statewide. The governor's executive order also directed the closing of recreational entertainment facilities. Our mission is to protect and serve the residents of Grand Forks and the state of North Dakota as a whole. All of us need to practice social distancing, and these steps are taken to limit opportunities for congregating. We understand there are questions surrounding the specifics of implementation of the government's executive order from last night. We expect that there will be updates and direction from his administration, and we'll wait for further details at 4 o'clock. My guidance for churches and other businesses like salons, spas, and barbershops is as follows. Take action with the safety of your employees and patrons as the highest priority. Follow CDC guidelines, adjust your hours, practice social distancing, sanitize everything frequently, and consider temporarily suspending services to the public. I will not mandate the closure of these entities at this time, but strongly encourage them to take the above recommendations seriously. The governor's been leading on the state level, and I am mayor is prepared to take additional action if necessary to protect the residents of Grand Forks. We must be united to flatten the curve of the COVID-19 in our community. Our friends and neighbors and loved ones depend on us to exercise personal responsibility in these extraordinary times. I understand this is uncharted territory and a very difficult time for our local businesses and their employees. We're in the midst of a health crisis and at the same time an economic crisis. The city has a strong relationship with local partners like the Chamber and EDC. The infrastructure is in place, but their priorities have changed. We're all in contact with the governor's office, commerce, and federal partners to do everything we can to make sure business continues. I applaud all the businesses who have already acted proactively and have taken a heavy heart for all the tough decisions owners are having to make. These are serious times that require serious decisions. I urge all the citizens of Grand Forks to support our businesses by utilizing drive-through, takeout, and delivery services when possible. I had my takeout pizza for lunch, and I'm looking forward to more. We are grateful for local businesses as well as community partners for stepping up in multiple ways in our community's time of need. We have created a page on the city's website where you can find community resources, including food, grocery resources, home utility resources, and local business response assistance at grandforksgov.com/resources. Over the weekend, we'll be working with our collaborative partners in all policy areas like schools, housing, nonprofits, and businesses to get actionable solutions in these areas during these challenging times. We will keep you updated. Again, I want to assure everyone that the city is continuing to exercise its mission to protect and serve. The flood action plan is being implemented, and we'll be ready for whatever comes our way. Mr. Field will be providing a quick brief summary on those activities. As you saw yesterday, streets are being plowed and garbage is being picked up. Our public safety departments like police, fire, and PSEP are continuing to execute their mission to keep us safe. We have closed our buildings to the public for the safety of city staff and the public, but we're still doing business. I encourage all residents to utilize our virtual city hall at grandforksgov.com/virtual to fill out applications, pay bills, and apply for permits. These are extraordinary times. I cannot stress the importance of personal responsibility enough. We need to take these actions for each other. Together, united, we will overcome this. Thank you.
Thank you, Mayor. Also on the call here, I'm sorry, I should have prefaced Mayor Brown obviously giving his statement, and then also we will hear from Altru and Dr. Josh Deere. Also on the line, not expecting to make a statement, but available to answer questions, Mr. Todd Phelan and Ms. Deb Swanson from Grand Forks Public Health, Todd Phelan, City Administrator. So next, we'll head over to Altru and get to Dr. Deere. Hold on one second, Josh. We'll get you all situated. Go ahead, Doctor. There you go, Doctor.
All right, so you can hear me? Thank you. So we're here today to discuss again from a community perspective what we can do as a city, Department of Health, and health system for how we can combat COVID. We continue to press on with our daily operations as usual at Altru, in quite a different time. Our phone call volume yesterday, again on the COVID line, increased. We continue to screen patients as the North Dakota Department of Health guidelines change in guidance from them. We're limiting visitors to one, as I discussed yesterday. We're working around the clock 24/7 in our command center. We're continuing to practice social distancing, frequent hand hygiene, washing surfaces more often, including doorknobs and table surfaces. And from a personal perspective, our lives are changing. I mean, I haven't seen my wife very much in the last couple of days, or kids, but I think the work that we're doing here at Alter Health Systems is very important. And we continue to support our community partners as well as other regional hospitals as they look for guidance from both us and the state. And we're having talks on a daily basis about how we can pool our resources to combat COVID the best we can locally. So thank you for this forum again, John.
Thank you, Dr. Deere. As we sit here, wasn't expecting any prepared comments from Mr. Phelan or Ms. Swanson, so we will open the floor up for questions from the media. And please use the hand raise, and we have one right here from Mr. Joe Bowen.
Oh, can you guys hear me? All right, cool. How many testing kits does Altru have available at the moment?
Dr. Deere, did you hear that question? The question was, how many test kits does Altru have at the moment? I will get you unmuted. Go ahead, doctor.
As it's changing by the hour, I don't have the specifics, but what I can tell you is we are responsibly prepared with the limited number of tests, both locally and nationally. This isn't just an Altru problem. To accurately test and diagnose patients that have concerns over COVID, particularly those who are at the highest risk. The North Dakota Department of Health is changing the recommendations, and we're making sure that our testing supplies are in line with the needs that we're going to need in the future.
Another question from Mr. Joe Bowen from the Grand Forks Herald. Go ahead, Joe.
Hello again. So do you have a number, even a ballpark one?
Go ahead, doctor.
No, we don't. As I said, we're actively managing the situation, and we feel that we are at a safe spot for the patients that we are planning to treat in the coming weeks and months.
And Joe, did you have another question?
I have quite a lot. What is the requirements for getting tested for the coronavirus? What sort of, like, how do you guys decide who gets a test? Presumably.
Sure, go ahead, doctor.
Yeah, so how we decide who gets a test really is dictated through the North Dakota Department of Health. At this time, the testing is more limited, and that's understandable. If you think about it, if we screen every asymptomatic patient right now that wants a test, we aren't going to have the needed tests for those that really need it the most. And the people that need it the most are those who are admitted to the hospital and have serious illness, those who have exposure and other risk, and those who are in the healthcare field. So we need to make sure that we're testing those populations, both from a patient and community perspective. If we have staff that are also ill or carriers of the COVID, we want to make sure we have testing available for those people so that we can be properly quarantining and reducing the risk for our community and as a whole.
Thank you, doctor. Any other questions out there as I'm looking for a raised hand? There's, sorry about that, Joe. You said you had quite a few. So
yeah, quite a lot. I put out a thing on Facebook and Twitter and said, hey, what questions do you want me to ask? And now I have a 5-page Google Doc. So I guess I have one more question, I guess, on the healthcare side of things. And that is, how many tests have you guys administered in Grand Forks?
Go ahead, doctor.
Yeah, I don't have the specific number in Grand Forks, but I know that our health system, as of this morning, 7 a.m., we've screened over 200 patients through our COVID hotline and our curbside screening and screening throughout clinics that have appropriate patients who had met criteria at that time.
Thank you, Doctor. Go ahead, Joe.
Oh, yeah. Sorry, I just want to make sure I'm not steamrolling anybody here. Let's see here. Do you feel that Altru has enough personal protective equipment if infection rates rise in the area?
Doctor.
Yeah, at this point in time, we have enough PPE or personal protective equipment and are in constant communication with our state health department on supply availability. However, this is a national shortage, as I said, and actually not just national, a worldwide shortage. And you do hear about this on the news in places that are further along in the COVID outbreak than we are. So this is something we're actively managing, and we're managing responsibly.
And before I go back to Mr. Bowen with the Grand Forks Herald, to your point, Joe, we'll get back to you. Don't worry. Does anyone else have any other questions, or should we have Mr. Bowen continue to go through his list? I don't see any hands raised at this time. So, Mr. Bowen, with the Grand Forks Herald, I have opened your mic. Continue down the list.
All right. So this is me kind of consolidating a few different questions, but basically, as people come back from, say, spring break, or maybe they're a snowbird coming back from another state, is there anything they should be doing once they get back to town? Should they be self-quarantining? For how long? What should they be doing?
I'm going to start with with Dr. Deere on this one, and Mrs. Swanson, if you would like to jump in on this one, just let me know. But we'll start with Dr. Deere.
I think you're going to hear the things that we all say, and the president's been saying, our governor's been saying, our local health department has been saying over and over, is that we are wanting those people to self-quarantine right now for 14 days. Also, hand washing, the coughing into your elbow, personal distancing, those are all things that these people should be doing.
Thank you, Doctor. I'm going to get it over real quick to Deb Swanson. Deb, do you have any comment on this question at all?
Yes, I do. Thank you, John, for the opportunity to add a perspective from the Grand Forks Public Health Department. We too are concerned about the possibility of students and others returning to the community perhaps after spring break from all of our higher education institutions or others that are traveling. We have a location on our website where they can go and complete a survey, and the information will go to the North Dakota Department of Health, and they will get information and advice as to the areas that they've traveled and whether they're high risk. I also want to point out that there are a number of ways to communicate with Altru, with Grand Forks Public Health Department, and with the State Health Department. For Grand Forks Public Health, you can call 787-8100, Monday through Friday, 8 to 5, for questions related to testing or any other questions related to coronavirus. Altru Hotline is limited to people who have symptoms and want to know if they should come in and be tested. And that number is 780-6358. Also, we are taking messages on our website, and that address is health@grandforksgov.com. We do implore the public to please follow the guidelines for social distancing. It is extremely important at this time, especially as we add additional venues where people will be limited access or no access. We understand this is asking a lot of people, but it is really our best public health tool to preventing the spread. Once again, back to the issue of college students or others returning to the community, we strongly encourage that they get in touch with their institution. UND has been reaching out to students, advising them that they do not need to come back to campus until April 6th. They should check the UND coronavirus blog on the UND website for more information. And I would say the same is true for any other institutions.
Thank you, Deb.
John, this is the mayor.
Yes, Mayor.
Where you visit is important, but when you come back to Grand Forks, you go through the same airport hubs as everybody else who's returning home, and you're exposed to everybody who went everywhere in this country or the world. So I find it interesting. Yes, where you went is important, but also realize you've been exposed along the journey home. So I would strongly encourage that you do follow the guidelines and self-isolate. Care, and I would want the children in our community to be at daycare rather than to be with their grandparents. So I think right now that's our safest alternative, and I hope that they're continuing to use this, the safe practices of frequent disinfection and social distancing and other practices that we've responded to. But I do think that's the safest alternative we have at present.
Anyone else like to comment on the daycare issue at all as I look at our panelists here? No? Joe, go ahead.
Hello. So then just to clarify, if I run a daycare, I don't, but if I did, I would not be under an obligation to close as of yet, correct?
That is our understanding. Mayor, would you like to comment on that, please?
I did.
Yeah.
I think we'll follow the guidelines of the governor, but right now K through 12 is closed. Daycares are exempt at present.
At all, would you advise people that they should be stocked up on certain items or not? Or do you expect business to go on as usual at the grocery store and I guess daily item level?
We'll start with Mr. Phelan on this one.
Yeah, Ryan, I think as Hugo's really has been out front on this, is that they really are, the supply chain is good. They're getting things on a daily basis. And so there's no need for hoarding at this point. The supplies are good. They're getting things in daily. And we've heard that from other retail stores too, like Target and Walmart, that they continue to get shipments, even to Grand Forks, and there's no need for hoarding of.
Yeah, this is Neil Carlson with iNews. Getting a lot of messages from employees around the region. I'm not sure who wants to maybe take a stab at answering this, but can you give any guidance to employees and large employers, especially those at manufacturing and production plants, where sometimes there's 1,000 people at one shift in close proximity to each other? Any guidance for those employees and or employers at the large production plants?
Mayor Brown, I see you chomping at the bit on this one. Go ahead.
Well, right now our community faces three challenges. We have the COVID-19, we have the upcoming flood fight, we also have a pending economic crisis. So with the COVID-19, we have guidelines from the governor and departments of health for what we can follow. The flood fight, you'll see things happening on the Greenway. If you go to the National Weather Service website, you'll see certain actions we take at certain depths. So we're being proactive in some of the low-lying areas so that we won't be scrambling at the end to protect our community. The third thing, we have the economic crisis facing our community. We have business listening sessions coming up next week. And we have, on Monday, we have food and groceries, restaurants, similar establishments. Tuesday, we're going to talk about retail. Wednesday, we're going to discuss manufacturing. Thursday, we're going to discuss professional services. And all these will be done with the assistance of the Chamber and the EDC. And I understand that we have information from the governor's office about unemployment and how people can apply for that. So Todd, I'll turn it over to you.
Go ahead, Todd. Hold on, Todd, 1 second. It's not allowing me to unmute you. There you go. Go ahead.
Okay. There's going to be more guidance coming out from the state government, federal government, and we know Congress is going to pass a stimulus bill of some sort. The state government is moving forward with some proactive programs regarding small and business and the like. And I think as the mayor just said, there'll be more and more information coming out next week to include listening sessions, and not only important to have listening sessions, but to have answering sessions so people have some predictability and actions that can be taken sooner rather than later. So more coming. We're going to organize ourselves over the weekend, get these policy areas organized, and then develop some action plans for next week.